Hello, good evening. How are you? How are you day? Welcome to another session of Ask the Doctors. My name na Dr. Frederick Unugbohai. People call me Dr. Fred Dostar. Now, I always tell you good life, not sense. Now, this program holds every Sunday by 8 p.m. Nigerian time. So, in case you do watch me, wherever you day, good morning, good afternoon, good evening. And we don't dey do this program for a very long time. Now, today's program, today, na question and answer session. Today we go take your questions. So if you get any questions for me, I'll be the host. My co-host now, Dr. Israel. He go soon join us on the program. Dr. Israel will soon come up and we go take your questions. But I beg, we know they give number on this page. We know they private chat anybody. We always beg you if you get any problem, any medical condition, make you go hospital. Because I notice say a lot of people they find make person give them medicine on the internet, and we know they careless with human being life. So I beg, in case you get any medical condition and you dey watch me right now and you dey find medicine, we go advise you to go hospital. We no go give you treatment on this page. We know they do that one here, no vex. But if you get any question, feel free to ask me. If we know the answer, we go respond to you. In case you don't know, we are licensed medical doctors. No be say we just carry the name doctor put for our head. We get license, you understand? So when we dey talk, we know wetin we dey talk. And that is why we dey careful as well to dey give people medicine on social media. So any question wey you get, drop them and we go answer you. I dey live on Facebook. I dey live on YouTube. I also dey live on TikTok. Chukwuka Emmanuel, how are you? Kalu, good evening. Happy Sunday. So I beg, no matter how much you beg for medicine here, please, we know they do that one. Yeah, we know they insult our profession on social media. So if you get any question, feel free to drop your questions because today na question and answer session. And now 1 hour we go use. So I beg, try drop your questions so that I can respond to you by the grace of God if we know the answer. Somebody they ask for my number. I know they give number. I beg. Okay. Now there's a question here. Media. This person says, please, I beg, wait till make person see period 2 times in a month. Dr. Israel is in the house. So people on TikTok are going to need to end the live session. Dr. Israel is in the house and I'm going to bring him up. Dr. Israel, if you are ready, just give me thumbs up. I'll bring you up. Dr. Israel, if you did ready, just give me thumbs up and I'm okay. Let me bring up Dr. Israel. Dr. Israel, how you doing?
Fine, fine. Good evening. Happy Sunday.
Yeah. Happy Sunday. Welcome. Okay, we get one question here. May we see how many questions we fit take tonight. It says, Doctor, I beg, wetin make person they see period 2 times in a month? So make I answer you quickly. For some women, it dey normal to see period 2 times. For some women, it dey normal. Most women think say because every month they come, period now once in a month. Some other women say they fit see their period once in 2 months and it dey normal. Because you need to know wetin be the length of your menstrual cycle. If the length of your menstrual cycle dey short, like 21, like 22 days, you might see your period twice in a month and everything dey okay. If your menstrual cycle length be like 33, 34, 35, you can see your period once in 2 months. Nobody go panic, you understand? So you need to know the length of your menstrual cycle. And for some people, seeing their period 2 times in a month, they very, very okay. Dr. Israel, you get anything to add to that?
No, they already talk am. It's just for them to know, say, seeing your period not be monthly thing. So it's not compulsory that you must be seeing it you go to see it every month or not be monthly thing. So we only look at our cycle when you see the first one, when the menses return again. So now that one they very important. So every other thing with Dr. Fred talk now, That's what it just be.
Yeah, thank you very much. You're welcome. So if you get question, I beg ask your question. Okay, we get question from YouTube. Omar Sharif from YouTube. He says I'm from Sierra Leone. How man is it man? How man they get infection quick? Is that what you were asking? How man take they get infection quick? I don't know, but if that's what you were asking, Dr. Israel, if you respond, I beg.
No, we really need to get the question well because he said how many infection quickly. So more get the question well.
Okay, how many get
If
infection?
yes, because now MANY that's in a many.
How many?
So
Okay.
now you will fit pronounce it as English word. If if like say we not get any English word for that word, now we fit
Okay.
the things in a man. So
Okay.
you should send the question again and give us the correct question.
Okay. Okay. Let's take another question here. Osinachi says, good evening. Which test can one that wash plate do for treatment of sore throat?
Okay, the question is first thing, why you even think say na the plate when you wash now cause the sore throat? So well, it's possible. Also, if you not just be in. So
Mm,
the other thing now, which other symptoms you they feel join that
mm,
sore throat? That's waiting your doctors go want find that before they go come even tell you the kind test when you go do. Yeah, and also the plate when you wash, how it was when you they wash and they smell and wait till you notice. So those are questions when they go ask you. And when you don't feel answer those questions, then they go come know the kind test when you go do. So we not feel tell you say go do this test, go do this test to just tell you say now this one be the solution. It is based on every question when they go ask you. Fear be say you just get common cold or cough. Now you want worry you now make you get this sore throat. You never can tell. If it be something worse than that, you never can
mm,
tell. So now to when you don't reach when you go hospital, and then they will ask you a lot of questions. From there, you'll be able to when you feel answer those questions, they will know the kind of investigation when you go do. So that make you not just go any lab, go waste money, and then
mm.
reach hospital, doctor go tell you may you go do other tests.
Yeah, thank you. If you just they come, you did welcome. Good evening. Today we did do question and answer session. So if you get any question, drop your question and share the live. Beatrice, are you here? Beatrice, I see your comment. Let me respond quickly. Give me 3 minutes. Let me respond. Beatrice, good evening. Okay, so um, my attention was drawn to your page. Yes, my right manager, the person where they helped me, they flagged your page because you posted my video. But when we wanted to restore your page so that the flag will leave your page, we can't find your page. You understand? It's like you deleted the video, so there is no way we can remove it from our end. They told me about you. I saw all the email you sent, but I need to address you right now because you did here. I also saw the video where you were feeling so sad. Yeah, I told them to remove your page, made them no flag your page, but we have been looking for your page. Is no more there because you have deleted the video. So if the video was still on your page, we for free restore back your page. So I have to let you know anybody will post my video and then flag them and the person they genuine, we go restore the person page. So no vex, it's not from my end anymore. So you get yes. Okay, let's go back to the next one. Good evening, doctor. If a woman do evacuation, what is her chances of getting another pregnancy?
Okay, his chance, he had a very high chance of getting another pregnancy. And that will depend on who do the evacuation for him. If you go meet experts, may they do the evacuation for him, he get a high chance of getting pregnant. In fact, within the next 2 to 3 months, the person fit still get taken immediately after
Yeah.
the evacuation. Now, only when it can be saying the overscript or who do not na quack, now there sometimes people they get problem. And another thing where they also make some people they get problem now when after the evacuation, you yourself, your mental health never come back to normal. You never dey stable very well. So sometimes the hormone itself not go work well for you. As at that as at that time, you may not get pregnant on time. But most of the time, when after evacuation, there's every tendency within that period, within the next 2, 3 months, you can also take in. And it all depend on how your fertility be. And depend on how your fertility be and who do the evacuation.
Thank you, Dr. Israel. Let's go to the next question. I beg, share this live session. Let's see if we can spend more time here. Okay, doctor, please. Waiting fit cause back pain, waist pain, and leg pain. Make I answer quickly. Many things. But remember something. A lot of people in this generation will get back pain. Number one, most time the kind of work where we do, people they sit down for too long right now. So they fit get back pain. Some other one be say age if make you get back pain. Some other people maybe they don't involve in accidents or they get a medical problem for their body. We don't the near that area of the waist. Now, because you can't put say they get waist pain and leg. So from that waist pain, it don't they enter your leg. That one is something where we no go like use play. If to say na just waist pain, we fit tell you say, okay, try rest, take pain relief, maybe you go. But if that pain don't they come they near your leg now, they affect you for leg, then it's important you speak with your doctor so that make you no go lose your ability to walk later on. Dr. Israel, I don't know if you have anything to add.
Yeah, that's not true because and when you say back pain, waist pain, leg pain, if they together, maybe they worry you together, then you need to actually see your doctor. And your boss say the back pain when they even talk now low back pain. So low back pain to the waist, radiating to the leg, lower limb, not be better thing. Sometimes na the nerves na they get problem in that case. So if the nerve don't they get problem, if you come reach one place when the nerve will don't compress, you know, can't fit use those leg take waka, or you can't need walking stick till they support yourself. So for that reason, you will need to go to hospital, see your doctor, eh, eh, most likely an orthopedic doctor where they specialize for bone. Now you need to see. So the fit tell you may you do history or CT scan, depend on what they their mind, or depend on how they talk to you, make you do, may they see those aspects of your body, and from there they go fit tell you what and what they go do or how they go fit treat and make you for day fine.
Okay. I beg, if you never share this live session, support this live session by sharing. That way we know so we did together. Doctor Abeg, wetin make person dey see period after taking Postinor 2?
Okay, and normally you are supposed to see your period now, and two, most of the time when you take Postinor 2, the first blood when you the first measures when you dey see not be actually your real measures. That one na the medicine na cause that one, because wetin the medicine dey do, the medicine go make sure say the wall of the uterus dey thicken, to that extent say nothing go fit come stay there. So because nothing fit come stay there, after some time all those thickened wall of the womb go pull out, go peel out, and all those one go come out as that first medicine when you dey see. And that makes for some people they fit see am for a very long time. If fit bleed for more than 2 weeks, while some people they'll fit see am, then after 1 week or 2 weeks they'll come see another medicine, because that first one when they see now because of the drug when they take, not be their real measures be that. So it is after later they can see their real measures. So now what needs to happen, because while you take the drug, when did you take the drug? So did you take the drug because you don't want to get belena, or you don't want to make a small baby coin, a small you dey inside you. So because you don't want that, you took the drug, and wetin go make us say no, say yes, it really not really happen, and that menses, like that menses when you call, now go really happen. So sometimes now the drug now really cause that, not just your real menses. And because you don't tamper with your hormone, you don't change your hormone system, because the drug actually they work with your hormone. So you go temper your hormone, so your hormone go re-regulate and re-change. So in the process of doing all that, you go see your menses irregularly for some time before you come normal again.
Doctor, is there any problem for a woman and a man to abstain from intercourse for a long time?
Okay, most of the time we dey always get this question, but there's no problem. Whether you are staying for 1 year, 2 years, 10 years, there's no problem. Now wetin you wan do? Now wetin you wan do? After all, if there's a problem, there are some people for this life when take that vow of celibacy, and nothing happen to them. So there's no problem if you decided not to. We know say most times we dey hear so many things, so many comments say, hey, na because you never, na because you no dey knack since, na im cause am, na because no be, e no cause anything. E no cause anything. So if you decide by yourself, yes, you may feel some kind of pain around your body for some time until your body get used to it and know say, oh, that is for people wey don dey knack. If you can't decide say you no go knack again for some period, because you must feel it. And something wey you dey always dey do, or something wey you dey do before you can't leave am, you go must feel am. After some time, your body get used to that your new you, and you are good to go. There's no problem.
In addition, you get another thing wey dem talk say, if you never intercourse for a long time as a woman, say nine they make am cause fibroid. No, it's wrong, abeg, because you get one video where I make about this matter, and I saw some comments there say, if you be woman and you know intercourse for a long time, say you could get fibroid. It's false, abeg. Just like wetin Dr. Israel talk, a lot of people know they do the intercourse and they are very fine with it, but so many false information there outside. So just follow wetin we talk, live your life. If you won't go back to your intercourse, it's your choice. If you say you no wan do am, na your choice. Just that for few people, they fit very few, they fit get one or two issues. You understand? Okay. People are not sharing the live session, and it's very sad. I don't see the names of those who share the live session. I go soon call their names. Doctor, what will be the size of kidney stone that can lead to surgery? And what is the recipe of kidney stones?
Okay, for the size of stone wey fit lead to surgery, that will depend on your kidney, the kind of pain wey you dey receive, and the doctor itself. But okay, and yes, the condition and the doctor itself when they look am. But most of the time, when the stone don big pass wetin go fit pass through your ureter, or your urethra, so na something when they go need to use surgery to remove. And wetin dey really cause this stone na all the waste product when we dey release from our body, na dey form the stone. And that stone dey only form when you no dey take a lot of water, a lot of fluid. Because wetin water dey help do, water dey help dey e go make our urine no dey concentrated. So in that way, e go dilute the urine. So those chemicals, those substance wey dey our body, when our body waste product, when our body wan remove, na the water wey we take, or fluid wey we dey take, na dey dilute those things so that they go remain as fluid like normal. But if we not going to take a lot of water, because the body must take a normal amount of water wey e needs to take give you your normal life. So if you not dey take a lot of water, one part of the body wey dey suffer na the kidney, because e go drain the kidney. Then you can't see your urine go dey yellow, or you dey dark. Now they make most people go say they urinate, their urine dey yellow. It's just just reduction of fluid, na that one be, and reduction of fluid. So if this thing continue for a long time, and you not can't even the piece well, it continue for a long time, all those debris, all those dirty when suppose wash, where the water suppose wash, they go come go they gather from one place. As they gather, with time, they'll come form wetin we call the kidney stone now. So nothing say na sand na person chop, or person throw stone put for mouth na can go enter the kidney, no. Or you say na the sand when you chop when you be small pikin, na when you come hold na you can go to the kidney, not being true. Because most persons the water wey they take not too many, and it dey lead to that. That make one way of treating kidney stone is to tell the person to they take a lot of fluid. And when they take a lot of fluid, and even when the stone don't they form small, without without lot of fluid when they take, if it dilute those stones, that is those small one will not be the big one. If it dilute those small ones, then the person go feel urinate and come out. However, if the stone they very big, and around I think 2 centimeter or so, 2 by 2 or 3, something of that nature. I can't remember the number, the figure. Well, big, then you not go feel use fluid, take methane. You go need to go do surgery to remove them.
Thank you,
Dr.
Dr.
Fred,
Israel.
any other thing?
Yeah. No, nothing. Thank you. I beg, if you just they come, we they do question and answer today. I beg, for this page, we know they give number. We know they private chat anybody. I beg. Here now to advise you. We know if we treat you on internet because we don't know you. We don't know anything about you. That is why we always beg people, say make you go hospital. But if you ask us question, we need clarification, advice, we feel clear you. But if you dey find medicine for here, I beg, here no be hospital, and we get our medical license. And our medical license, they precious to us. So we know what they use anyhow, they talk anyhow on the internet. So I beg, yeah, so that make you no vex if we know answer you and give you medicine. Good evening, doctor. Happy Sunday. Is family planning advisable for women? Because I heard that family planning causes the different sickness. How true is that?
Okay, the thing is that it's not be truth, not be true. Yes, we dey hear so many things about wetin people they talk about family planning. Family planning is actually advisable for women. However, say family planning is also like drug, and it's medication. So there's every medication, every medical stuff gets their side effects. So everybody gets your way until they react to family planning. Now, may I let you know, say there are two types of family planning. There's natural family planning, there's artificial family planning. So if you say family planning as a whole, I know say that the artificial, the one where they use medication and injectable and all that, now you they talk about. So if they talk about that, there are some persons that it may not work well with them. So if you are the kind of person that family planning will not work well with you, you don't need to take it. You just need to try and focus on the natural form of it. And because as I said, these things are medication, these things are medical instrument or medical things that are used. And so, and the body, they sometimes react to some of all these things. So if you react to it, just like if we give you some medication and you react to it, we will stop you from that medication. Like some people, when they react to Septrin now, they're not they take Septrin, they're not they take anything we contain sulfur. So if you consider the person where they react to any ingredient within this family planning, we're not gonna give you that. That make there are different type of family planning. So the one where they better for you, 9 they go try give to you. After the doctor don't carry you sit down, or the nurse or whoever they give you the family planning carry you sit down, it go explain all the type for you, the different type of family planning. The one when they call implant, no, the one when they take injection, the one when be tablets, the one when they insert enter the body, and so on and so forth. It go explain all of them for you. It go tell you all the different how they work, and the ones where you get side effect, everything. It go tell you all of them. When you tell you all of them, now you will come by yourself, choose the one when you really think say it will work better for you. So family planning is very important. It's good because they help they help family to plan their budget. They help more women and children. So it promote bonding between mother and their children. It reduces maternal mortality, and so many other things. Yeah. So no, if they tell you say family planning not good for women, not be truth. Is they very good, but you go need to know the one when good for you. Then at that one, now you go use. If the one when you get for body not good for you, you go meet hospital, go hospital, they go remove her, and you go then normal again. Nothing spoil. That's all life just be.
And that is why we always advise you, no just take family planning anyhow, unless they don't explain everything to you. One problem where they see online, most ladies go just wake up, collect any family planning on the internet, use for their body, go can't get problem. You need somebody to sit you down, madam, explain how each of them be. You will come and the person will come decide, say, I bless now this one. No, just go buy any family planning, use for your body. It no good, huh? Doctor, what causes wound in a woman's private parts?
Okay, there are many things when fit cause wound for woman body like that. There are so many things. I go start. Dr. Fred, are we still together?
Yes, we are.
Okay, so I go start with may I say the most easiest or the one way they commonest pass. One of them are the way where the man they enter. Eh? If the woman not too dey wet, they dry, and the man they enter anyhow, he not use anything to make am wet. Yeah, and not just anything, not use the right thing like lubricant, to make am wet. If he cause injury for the woman, it go cause small injury for the woman. Now that one na most common of all of them. Another one na tear, either from childbirth, either from stitch, the same knacking. You can also have tear. That one na say injury for the woman. Then there are some infections when fit cause all those kind of injuries, sores for the woman. Herpes, some na viral infections, and majority of them are viral infection. Herpes fit cause am, HPV fit cause am. So these one are different ulcers when go fit dey the woman private part. And sometimes when some people can get allergic reaction based on the kind of things when they themselves they put for their body, some corrosive things where they form say they want wash, they want clean. So the process of putting all those things, it can actually cause burns for them, and they go get all those injury. Okay, these are just some few. Make I not come talk too much. These are just some few. Dr. Fred, if you get others, you can
Yeah.
say.
No, basically, these are the very common ones. Yeah. Okay. Now let's take more questions. Let me see. Oh boy. Oh. Okay. Good evening, doctor. Happy Sunday. From Gifts. I need an answer. Okay. My friend has boil each time he shave his beard. What can he use to clear the boil? Hmm.
Okay. Normally we not dey actually tell person anything to do like in any case like this. We can lead to us to come be like say we want prescribe medication or prescribe anything for a person. So it simply means say your person may be having reactions with shaving, or reaction with not the shave on time. So for such person, either they shave on time, or e not your shave at all, but they maintain the beard so that make e no dey get those burns. Yeah, na burns they get. So yeah, there are some medication you can use. There are some cream you can use. So that one, now when you reach hospital, when you make your complaint, your doctor can actually tell you the medication when you go fit use, so that those burns go stop or go reduce. Most of the time, it may not stop finally, but it go reduce the number of burns and all that when you go get. And they go also tell you other things when you need to do or when you need to know, so that make those rash swelling or all those burns for now they come out.
Yeah. And in addition, might I add something. Nobody tell you saying a boy. Most times, now the way your friend they shave the beards. You get how your hair for your body, every individual. Some people their hair they come straight, some their hair they bend backwards, some their hair they bend forwards. So if you go shave the hair in a direction where the hair they grow opposite that direction, the person fit get issue. Where we say when the hair won't come out next time, if you can't they swell up, they give problem. So one very important thing now, how your friend they shave, you need to monitor and take note of how in the shave, waiting in they use the shave, because after dem treat am, if e continue to dey shave like that, the bumps, those swellings go still come back again. So follow the advice wey we don already talk. We no dey prescribe, but most times dem fit give you cream. Na cream dem go give am wey you go rub for there, wey go help heal those things. Yeah. Please, what's the cause of heart palpitation?
Okay, Dr. Fred, you fit answer that now.
Lydia, many things, plenty things can cause heart palpitation. For those wey no understand wetin heart palpitation mean, heart palpitation mean say you dey hear your heart beat fast, big, 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 big. Example, if you run very fast and you stop, you go dey feel the heartbeat. Now, for some people, they no dey run, but they just notice say their heart dey beat fast. Wetin fit cause am? Number one, your lifestyle. You get some individuals, the kind thing wey they take, things like alcohol can actually increase your heart beat palpitations. Some other people now energy drink, caffeine, and the rest. Excuse me. For some other people, they get heart issues. The heart itself get problem. So when this person enter hospital, they go do one or two tests on that person's heart to actually know wetin dey make the heart dey beat fast. Because inside your heart, e get something wey dey tell your heart say beat normal o. But if that thing for the heart can't they over give information to your heart, the heart fit dey beat very fast. So they go check that one. And then some other cases again, it fit be say the person gets issues for other parts of the body where they talk to the heart, where they make the heart beat fast. Example, like issues with hormone, it fit also cause them. Then people dey too where they take some kind medicines. Those medicines get effect on the heart. Those things too fit make the heart dey beat fast. And then some other cases, we fit just say, madam, maybe you dey very stressed o, oga, you no dey sleep o, you dey experience wetin they call chronic fatigue syndrome, and your heart is telling you, I need rest, I need rest, I need rest. So these are some of the things wey fit make you dey hear your heart dey beat fast. And that is why, again, we'd also encourage you, you go need to get a one-on-one discussion with your doctor so that they go sit down, examine you, find out wetin dey go on, and if you need any test, they go tell you. If you need any medication, they go also give am to you. Now, I beg, people they ask questions. We dey take the questions as they come. So when we reach your turn, we go answer you. Yes. Okay. Let's see. No, we don't answer this one before. The person says, "Good evening. Doctor, wetin dey cause constant headache?" Okay. Ma respond. Wetin dey cause constant headache? Normally, you're not supposed to get constant headache. From time to time, people they get headache. People see normal human being, get wetin you go do, your head go pain you small, you go rest. But when it come become constant, no good. One of them, na stress. Another one, where they common, where people know they look, maybe na problem with their blood pressure. Another one, when they get issues with hormones too, fit make them get headache. Eye problem fit give person headache. Some things fit they go on inside the person head, like if they get small thing we just dey inside, it go dey give the person headache, with the heat. Then sometimes you get water where they dey for the brain and the spinal cord. Some people fit do some kind things. That water fit come go dey big, fit cause problem inside the head. Or infection. You get certain type of infection where person go get, many infections by the way, fit make you dey get headache. Some people too, their headache fit dey very severe, like migraine. So when you look light, when you hear loud noise, or when you dey stress or fear, that headache fit just come like that. So if you dey get constant headache, we know they like them at all like that. So the first advice we will give you online here, try rest. But if you know say you don't rest, you don't take your medication, you don't check your blood pressure, and all these ones they normal, please enter hospital. They go look you, they go look your eyes, they go check your ears and many other things to actually find out waiting they give you headache. Doctor, I missed my period yesterday and I checked with a PT strip. It was negative. Could I be pregnant? Dr. Israel.
Okay, the answer is that as far as yesterday you supposed to see your medicine and you're not saying you don't really need to be afraid. I never supposed to even do pregnancy test today most of the time. You need to give yourself at least 1 week. After 1 week, when you not see them again, before you're going to think of doing pregnancy test. Another thing is that how old are you? So your age still determine. Another thing is that are you really what kind of work do you do? It stress you. Are you really stressed? That will still
Mm,
determine why you not see your menses and when you suppose see am. Another thing na be say you take any medication when you by yourself prescribe for yourself.
mm,
So all those ones still join wetin you need to ask yourself and answer. So when you fit answer those questions, and then you go know why your menses actually not come out yesterday when e suppose come, or why you dey feel just why your message don come out yesterday when e suppose come. Another question na be say you dey feel the way wey you dey feel when your message suppose take come, when your message still dey how you dey feel when your message come, you dey feel am? If yes, okay, dat na still another sign say okay, e may come out to before the end of this week or not. So when you don fit answer all dis question, then um your doctor, you need to come reach hospital. Your doctor will come know what and what to do for you.
yeah, thank you. I beg people know they share this live session. Now wow, una know they show love. Oh. Somebody sent me stars, somebody sent us stars. I'm coming to your question. Just wait, I beg. Doctor, I beg, person with endometriosis fit still born pikin.
Okay, the answer is um yes, e go fit still born pikin, but e go need a lot of assistance from a physician before you go fit born that before you go fit born the pikin. And apart from a physician, if e know God well well or whatever e know well well, make e hold am well as well. um
Mm,
also um there is every ten dency say the person go fit get miscarriage. The incident of miscarriage for people wey get endometriosis is high. It's higher than normal. So those people they still need to even na make I talk say they need a doctor to deal with am very well, so that they go monitor am. They may even put you for complete bed rest. Depends on wetin the doctor see, and depend on how the endometriosis still dey really disturb you. Endometriosis no be better thing, I know. No be something we go want make any woman get or any woman um dey experience. But when e dey, you can still get pregnant. And but when you get pregnant, you will need your doctor, a gynecologist, abeg, not just any doctor, a gynecologist, doctor wey specialize for women, to monitor you till you born. So that make one, you no get miscarriage, and two, when you dey born, make you no go over bleed, and three, if that time reach sef, you need to get blood for ground, because anything wey happen, dem may need those blood.
Doctor, good evening. A situation where two-time operation was carried out on a 65-year-old man for prostate enlargement. The first operation failed while the second was successful. What is the possibility that the man will walk? At first, he can't feel his leg for a long time, like years. But a physiotherapy is going on so he can feel his leg now. But it's taking a long time for him to stand and walk. Can he walk? Hmm. All well, Roberts. Okay. Dr. Israel, go ahead, I beg.
Okay. I no go fit tell you 100% if this person go fit work, and I no go fit tell you say e no go fit work. Now the good news now is that you say they start physiotherapy, and as at now the person don dey feel a leg. So if the person don dey feel a leg, it means say with time the person may actually walk again. And with time,
Mm.
it may take a longer time, but with time the person will actually work again. So far that physiotherapy continue. So far the physiotherapy continue. Two, I begin to imagine prostate surgery that they did that actually have okay now I know why they affect why the leg. Okay, now I know why. Okay, so with time, the person may walk again. They just need to continue the physiotherapy. And one thing you should know is that nerve injury, they take a long time. So there's every tendency say now a nerve, one or two of the nerve, they injured before the nerve when they
Mm.
control those legs. Now they injured before, but as they heal, they come, the person go dey get himself back. And one of the process of healing na be this physiotherapy wey una dey do, and it is very good. So continue the physiotherapy, and with time e go work again. Also, not be say because e no dey work, una go just leave am for bed make e just lie down throughout. No, sometimes you need to take the person up. As far as you don dey feel the leg, you need to at least
Mm.
assist am. And there are ways to assist person. Don't worry, the physiotherapist would actually teach you guys how to assist this man so that he can move, so that he can start to the move. Just know say he go start to the move like small pikin again before you can get a leg, a grip very well as before. So now patience now una need.
Okay. Doris Lawrence. Doris sent 99 stars. Doris, thank you for the star. You send star. God bless you. Some other people no go send star. They no go still share the live session and then they ask question. It is well for our people. Oh, it is well. Doris, they ask question. Doctor, I don't normally have urge for intercourse, and I don't normally take in. Please, what could be the cause?
Okay, firstly, Doris, thank you for the stars when you send. We really appreciate. And secondly, to give you the best information so far is please see a gynecologist. Please see a gynecologist. Now then go fit tell you know the cause why you are not pregnant. Sometimes they might not even be cause. It may just be I don't know how to put them, because studies have shown that people will not get belly. Some percent is to the man, some percent is to the woman, some percent na both of man and woman, while some percent na nature. So you never can tell. So now when you do a lot of investigation, they will come find that now you get problem, or now your partner get problem, or maybe na nature na cause am. So and also that other part when you know they get urge for knacking, you need to I think it's that one a psychological matter, mental health matter. So when you need to rebuild your psychology, and some people get reason why they get urge for knacking. Some maybe because of medication. Some maybe just because they never taken, they have lost interest of knacking, saying I beg you, upon all the knacking when I dey knack, nothing they happen. So they go lost interest for it. That na one. Two, fit just still be say the way when you take dey knack, you the pain when you dey feel, e fit join wetin dey make you no even wan knack again. So there are many reasons when we make some people not they get urge for knacking. So you try and know the reason and try and work on that reason, and with time you may actually have urge for knacking. And with that urge, because when you know the knack, there's every time they say you may not become pregnant. And you also, to get pregnant, you need to know
Mhm.
your ovulation day when your egg will release, so that you can actually be able to knack within that period. And if your man's something when they come out from your man body, the ice cream when they come out from your man body, they good enough, then something will happen. So you need to see a gynecologist. Very important.
Okay, we get so many questions, so many questions. My God. Questions plenty. Let me see. Waiting they cause pile. Let me see this comment here. I beg. Are they scroll? Take 'em. Jerry Emmanuel says, waiting they cause pile and how can I treat it?
Okay, I think Dr. Fred have done a video on pie, hemorrhoid. I believe if you fit screw find Dr. Fred that video, you will get a lot of information about that. Because in fact, I think we have also done a live session like this on hemorrhoid. Pie, the second name, the medical name are
Yeah,
hemorrhoid. So we don't do. I think we've done a live session like this on that. If you still feel fine and you go still
yeah,
get all the information on that. But one or two things we go focus on people when they stay toilet for a very long time. People where they eat strong food when go come make they want go toilet or come they stress yourself. And those ones will cause if it cause problem for them in time. If it cause problem in time. So one of the way when they say you fit a manager now try to take a lot of fluid, eat food when go soften your stool so that mean you no dey stress yourself. Then if the pie don come out well well say e no dey go inside, you need to go hospital because e may just be say na surgery na dem go do take correct am. So that's all I can say. So if you get the video, try watch, you get more information there.
yeah. Go to my YouTube. The video is on my YouTube. I beg oh, make we beg our people. No, they share this live. Oh, God, I beg oh. Yeah, I dey see the people we share very few. Please, what can I use to cure toothache?
Okay, remember, Dr. Fred, I think most of the question when they related to drug, you mean just decide not to take those questions. You may just
Okay.
decide not to take those questions. Not be say because we don't want to answer you, but because we get rules
Yeah.
and we dey try to keep to our rules.
Yeah.
So anything
Yeah.
to cure
Yeah.
toothache, I think you need to see your doctor. And also for the meantime, before you see your doctor, you can be using salt and warm water. Take until they rinse your mouth. Put salt for inside warm water. Not be burnt water, not the one where you put for mouth, you burn on your mouth. At least warm water, put am for your mouth for some time, use am rinse your mouth, then throw am, then you will be okay. You may be okay, but you need to see your doctor. Dr. Fred.
Yeah. You see your yes, thank you. See your dentist. Good evening. What is the interval for hepatitis B vaccine?
Okay, hepatitis B vaccine, you have there are 3 doses for hepatitis B vaccine. For the first one is 4 weeks interval. So from the first dose to the second dose is 4 weeks interval. And then from the second dose to the last dose is about 6 months. And so the first one are 4 weeks, the other one is about 6 months or so. Yeah. So that's the complete dose for the hepatitis B vaccine. And when you go take the vaccine, they go always give you appointment day when you go need to come back for the second
Mhm.
day, for the second dose. But that's the routine.
Let's take this question and then I'll call the names of the people we don't share this live session to appreciate them. Orji Emeka is asking, can a woman that's never taken before get fibroid? Can a woman that has never taken in? I hope I get this your question correctly. Okay.
Yeah, I think you are correct. Can a woman that have never taken in before get
Get pregnant. No, get fibroid. Get fibroid. Dr. Israel, are you there? Okay. I think we have an issue with his network. May I answer you, Emeka? Can a woman that has never taken in get fibroid? So this is the answer. Whether woman taking or not taking, woman can still develop fibroid. However, you get what we call risk factors, where they increase the risk of say a woman will get fibroid. One, na woman African. Many women get fibroid without them even knowing. Number two, woman wey be say e tey before she carry belle born pikin, because without pikin for the belle, that place go dey empty. E put her at risk. Do you understand? So no be say because you never take in, any woman wey never carry belle go surely carry get fibroid. No, we are not saying that. But we've noticed that the risk to get fibroid they increased more when woman never born and she don't they enter those 30s. Do you understand? Because the womb don't they empty, and the womb, the uterus, they find things where go they inside. Hmm? Yes. Okay, because of time, so many questions. Let me take this question. Fungal foods, fungal foods cause strong. Oh, I didn't get this. Omega. Okay, let me appreciate people that have shared this live. So let me call your name. Chukuka Emmanuel, in KST, Alwell Robert, Chubi Empire, Dadest Obo, Soneye Motilola, Uju Stella, Posh Olivia, Joseph Sunday, Beatrice Oahimi, Daisy Choco, Gifts, Gift a B, Stella Amada Sun, Ame, Omo, Ame. Thank you, thank you. I see your comments. Dokbai Josephine, thank you. Okay, John, I see you. You have shared this live session. Orji Emeka, thank you. Felix Onome Stanley, Eunice, thank you. Rafiat Ibrahim, Adinoyi, Prince. Now, Una don't share the live session. Thank you very much. So let me see if any of you. Do you take questions only on Facebook? No, because people on YouTube are not asking, and we are taking the questions based on how they appear. Doctor, what is the best way to wash pickles? The best way to wash pickles is number one, no put chemical inside your pickles. So many young ladies, their pickles they get problem because they won't make the pickles they smell like strawberry, make it they smell sweet. No, no. Every pickles get in own unique smell. Every pickles, eh? So if you want to wash your pickles, the advice is to use water. Use water, or in some cases, maybe you want to use warm wash them. But to come they put soap inside, they carry all those wash, all those feminine wash. They wash your pickles. You are going to cause yourself problem. How? Inside your pickles, get normal. Inside your pickles, get normal bacteria, normal organisms there. If you can't use all those feminine wash, you they comot the normal one. The bad ones will come enter. You can't notice discharge, you can't notice itching and the rest. Yeah. Because of time. Doctor, what is the best food to eat if you have hepatitis B? Dr. Israel.
Yeah, I'm with you. Sorry, my stand just doing here.
Yeah.
What's the best food to eat if you have hepatitis B? If you have hepatitis, if you have hepatitis B, eat your food now. The only time when you go they think of anything is if the hepatitis B is actually active. Because if it's not active, because it can be in a quiet state when they really do you any, they really do any wahala. So if it's in that state, you don't have problem. But what we go tell you say, I beg, anything when say like drinking, smoking, all those things, you need to reduce them. Then your fatty diet as just eat your normal food though, eat your normal diet, but reduce alcohol and reduce any medication when they're not prescribed for you. Because all those things now the liver now they still they act on them. So that means you not to give the liver too many work to do. So if you not give the liver too many work to do, there's no problem.
Okay. What is the cause of heart failure? AK Pato. Oh yeah, let's go. We're almost out of time.
Now, heart failure, there are different causes of heart failure. Anemia can cause heart failure when the person not get too many blood for body. Hypertension can cause heart failure. And that are one of the main cause of heart failure. So there's also some problem when you arrive from the heart. When it can be say the heart itself don't over large. All those one fit cause heart failure. They'll fit cause heart failure as well. And so or there's a blockage in the heart, it go cause heart failure. Now sometimes they get problem with the blood vessels. When we say they no fit carry blood go back to the heart failure fit still happen as well. Even your diabetics fit even cause heart failure. So these are some of the commonest things wey fit cause heart failure. Now before you come dey think of even malaria for children, malaria fit cause heart failure. How e go take cause heart failure? E go cause anemia, and from that anemia e go cause heart failure. Yeah.
Our time is almost up on this live session. Doctor, good evening. Please, a trying to conceive mom that have gone through medical checkup and treatment but no pregnancy, what could be the cause of delay? This is from Gift Bassi.
Now remember when I talk about infertility, now I said something, say sometimes the causes are nature. So when it's about nature, there's it means say you are medically fit, your husband is medically fit, all of two of them are they medically fit. But we can't just say this is the reason why una not get belle. That one I would call unknown. We cannot really give that reason. Maybe now that one that you get. So in that case, you need to keep on trying. And first, you must know your ovulation. You must know your ovulation. And when you don't try, say you no want try again. There are other means of having your baby. There's IVF, which is another means of having your baby. There's surrogacy, which is another means of having baby. So when you don't try nothing, you need to go for other stuff. It can be that you are good, as your husband also do, as your partner also done his test. Your partner need to also do his test, so that we'll still know saying your side still good. Then when everybody side good, then you also know what to do.
Thank you. Our time on the live session is moving so fast. God. Good evening. Is it true that hot water cure fever? No. Hot water does not cure
Wrong.
fever. No, no, no. If
Next
you do, if
question.
you if you don't treat what is causing fever, you could just stay there. Let's see. God, let's take questions. Let's go. Let's go. What could be the cause of constant dizziness and headache? I think we answered this question. Doctors, please try to go back from the beginning. Though there's a video I'm going to post very soon. The causes of dizziness. E plenty well. Many things can cause dizziness, from ear problem, from eye problem, from problem with the brain area, from problem with things in your blood, from problem with fluid, from problems with the blood pressure. So there are many things that can actually make you dey feel dizzy. Do you understand? And then if you dey get dizziness and headache together, you dey feel like you won't fall and you dey get headache. Please, let somebody check you quickly. Okay. Somebody says, Messi says, I'm a trying to conceive mom, 34. Okay. Feeling different from the way I feel during my period, but I've missed it. I really want to do it, but don't know. Wait, okay, so two things here. You've missed your period. That means you are pregnant. Is that what you are saying? Mercy. To send star, somebody can teach you how to send star. So Israel, help me respond quickly.
Sorry, read the question again. I'm not getting.
A trying to conceive mom, 34 plus. I'm feeling different from the way I feel during my period, but I have missed it. Have you missed your period? If you miss your period, is that what you are saying? Cleo. Dr. Israel, you get it,
Okay.
right?
Okay, yeah. Well, if you have missed your period, congratulations. So if you say you have missed it, we really don't know what you have missed. But if now your period you don't miss, congratulations. Maybe you are pregnant. And another thing, some people feel that because they want get belly, they want get belly, they want get belly, and their body, even when they don't miss their period, their body go just take that form of they are pregnant. You just they give you that sign. You just they feel say, I be like say I don't get belly. It's why some not be true now. Your mental state now, your psychological now, psychology now they play on you. So if you miss your period, go do test to be sure say yes, you missed your period. do scan join.
Okay.
Then I
Yeah.
go advise that you go start ANC on time, antenatal on time.
Mm, mm, mm. Okay. Doctor, we are out of time. We'll spend 5 more minutes. We don't finish. Time don't go, but 5 minutes because of you. Doctor, can abuse of medication cause diarrhea?
Depends on the medication. If one of the side effects is diarrhea, you will have diarrhea.
Yeah, depend on the medication. That is why don't abuse medication. Okay, let's be very fast. Mo could just help you. My mom says she gets flashes of excessive heat accompanied with restlessness and dizziness. Please, what could be the cause? Her blood pressure is normal.
How old is your mom? Sometimes if person young new stop to dey see menses, they don't enter menopause. They feel wetin you say your mom they feel. So it can just be saying a menopause now they cause am for your mom. So um that's why I asked how old is your mom. So when they don't enter menopause, they can be having those symptoms. However, if it's
Yeah.
not menopause, I think you can go and go to the hospital. Yeah.
If na menopause, then na menopause they cause am for her. To know about menopause, you can go to my YouTube
Yeah.
video dey there to help you understand. What causes smelling vagina? If the vagina they smell very bad, most likely infective process. Let's see. Okay, we don't finish. These questions are just coming. Let's take the last one. Let's take the last one. After sending you star, you refuse to answer my questions. Don't do that here. Don't do that here. Whether you send star or you don't send star, we will answer your question. Don't do that on this page. We no talk say now only those who send us star we go answer. No. Some people no even share this live session. We dey answer them. So if we see your question, we go answer you. If we not see your question, we no go answer you. So don't do that here, Rafia Ibrahim. We are not here because of your star. Do you understand? We are here to answer you. And if we see your question, we go answer you. If we not see your question, we no go answer. It's not our fault. We don't do that. I beg. Um okay. Last question. How can someone sperm increase?
Where you
Uh
want make the sperm increase? Where you want make the sperm increase to? Now the normal amount of sperm from 1 ml, your sperm volume is okay. So what you'll be thinking about is how functional the sperm is. So if you
mm,
eat healthy food, do exercise, not the knack anyhow, your sperm volume and your sperm strength will be okay. So eat good food, eat fruits, a lot of fruits, watermelon, tiger nut, banana, coconut, uh, cucumber. All this one go help you, and go help as well. So when you dey eat all those things, you dey rest, reduce alcohol and all those stuff. And so then you'll be ready to say your sperm go dey very, very good.
Doris says, answer my question. We don't answer you now. We answered your question. Maybe you talk about the urge for sex. Say they get urge for sex and you never take in. Dr. Israel answered you now. Dr. Israel, I beg, just respond again. She say, we answer you. Say she know they get urge for intercourse and she no take in.
Okay, maybe she was not around when we answer your question. We actually answer your question. We say, and you will need to see your gynecologist. And two, for that, not they have urge. It depends. The reason it can be psychological. In most cases, some
Mm.
cases is mainly psychological. So sometimes it depends on how you take start to have sex. If it's very painful, some persons may not want to be having sex again. Two, as far as you say you dey look for child, some women, because they dey look for child and they knack, nothing dey happen. They go to just abeg you, no need, because they think say na waste of time. So with that urge go come dey comot. Three, another one na some persons they may get other ways wey they take dey satisfy their want, to the high extent say if e come reach the time for man and woman to meet, dem no go come feel, dem no go get that urge for sex again. So these are ways wey dey make people no dey lose, wey dey make people dey lose, not dey get urge for sex. And some people naturally dey get low libido. their libido is very low. So there are some people like that. So we not know the one when you join, but if you see your doctor, a gynecologist, because of your pregnancy, you can actually still ask them this question. They may want to treat all of them together for you. And if you know they have sex, there's every tendency to say you no go fit quick get belle. So you need that knacking to take the pregnant, but you don't need to just knack anyhow. The knacking, you must know when your ovulation be, when your egg take dey come out, so that when you knack within that period, there's every tendency to say you go get pregnant. And make sure say your husband also don do him own investigation to be sure say his sperm dey good.
Yeah, thank you so much, Dr. Israel. Thank you. We are out of time. We have to go now, 1 hour, but we have to spend extra minutes for some people. So it's time up. We really do have to go. We know they spend more than 1 hour, but because of today, now make we spend 1 hour. Dr. Israel, any final words?
Okay, for my final word, for those when we not fit answer your question today, e no mean say we no wan answer you. It's just that we did not see your question, or maybe one thing your question come dey very far, that when we dey screw, we don screw pass your question. So no be our fault. It's not like we select those to answer and select those wey we no wan answer. And another thing, if we still no answer your question, remember I tell Dr. Fred say get some question wey you no need to read that. If your question fall into that category, e fit be say na make your question was not read out. Mostly when your question don carry something like which drug to take, we no dey answer that kind of question. Also, for those wey share the live, thank you so much. For those wey no still share but listen to us, thank you so much as well. And because of you now, we make we dey here. So we go continue to dey give you guys the best and the correct information. But note one thing, we no go prescribe medication for you for this live session. Thank you.
Thank you so much, Dr. Israel. I beg for those wey just dey come now, where they send questions. I'm sorry, no vex, time don't go. And some people go send question. Your question no go show for our screen because wetin you send, the machine no like am. Facebook no like am. You get how you go put some kind thing where you go write, they go comment your comments, we no go see am. So you go think say we no wan answer you, no vex. And if you come late, also we no go fit answer you, no vex. We have to go now. We'll see you next Sunday. This program now every Sunday by 8 p.m. Nigerian time. So I beg, no come late. Remember, good life na sense. Take care and have a wonderful day. Bye-bye.